comms, if we want to improve our value and get more investment from the NHS into NHS comms, here's an opportunity to do something a little bit over and above what we're doing in our day job. So this next session, we're going to talk about some key questions. We're all focused on this, what we can do next, if anything, point. What way we'll do it is there are 4 tables where you'll go for 10 minutes each. So when you go to the first facilitator, you'll contribute your thoughts and ideas, then you move on to the next question. It'll be 10 minutes on each question and you'll rotate through all the different questions. I think the easiest way to do this, if you go back to where you were sitting last before the tea break, and then we'll start from there. And the facilitators will come to you.
Yeah,
facilitators will come to you, and they are Alex and Stuart and Debbie and Catherine. Thank you.
Oh yeah, Catherine.
Right, hello everyone again. We've got here the question, which is to think creatively. What could this network be doing in 12 months' time? And what could we do together which will show how social media changes lives? So it's a very big question. It's not quite a big question, it's a very big question. And 10 minutes on that was too little often. From the groups that I spoke with, particularly on what this network does for the next 12 months and what it's doing in 12 months' time, we've got a clear direction of wanting more best practice and case studies and practical help and support for people. And that's kind of broken down, when we say case studies, into libraries of examples of where things have been done well and how. So there's a good one from the Greater Manchester Kidney Network of how did you get over the governance issues, for example. If that's written down once, then multiple users could use that. Other areas are, is there a body of support somewhere for somebody to ask questions to? So that could range from just using, I say just, but that's not right. It's using the Engage Well hashtag to ask our fellow Engage Wellers a question beyond just today, or going all the way through to having somebody you could email or call directly who is a social media specialist to answer those social media and digital comms questions. So some sort of resource behind that. There's a constant want for sharing of good ideas and best practice, basically, is what this question brought up. But there was also a clear direction from the room here that the next Engage Well event, or the evolution of the Engage Well network, needed to include more healthcare professionals, service managers, people who were closer to the patients themselves. And I would have thought some patients too. So we got a bit more of a rounded example, and comms teams enjoy the networking between the comms teams, but they would also like to have that perspective from others so they can solve things like when some feedback is put into the trust, if it's positive or negative, how would the healthcare professional like to deal with that, manage with that. And let me just check here to see whether I've got anything else. There's a really nice point actually, which is these case studies don't need to be massive. They can just be small, little, good bits of practice, things which have gone well, short paragraphs which just fire off an idea in your head. And I like that because that certainly matches the content of social media, the stuff which works well. So pictorial, small amounts of text, and using the Engage Well hashtag potentially. I'll finish on what James said as a healthcare professional was, posed the question is, does Engage Well as a hashtag resonate with healthcare professionals? And his guess is probably not. So what happens there is a question posed back out to the network. Thank you.
Thank you. Okay, so my group was answering the question, what are the aims of your social media organisation? So what are the aims? And then the second part was, how will we measure success? So there's two parts. What are the aims of using social media for your organisation? And how are we going to measure success? How are we going to know if it's effective? One aim is for the social media network to be sustainable. There was someone made the comment, do we want it to be effective or do we want it to be big? Maybe that's another question you could ask. Can you have both? There's a feeling that small is good. That kidney network in Manchester is kind of smallish, sort of 200 people. And it's locality based as well. So small often is good. One aim is to learn how to manage the local offer and know why you're doing it. So in other words, know why you are using social media. One aim is to know your reasons for engaging with social media and to define your aims. Actually write down, be clear, be public about why you're trying to use social media. And one way that you could check effectiveness of that is to check back against the objectives at a later date. Another aim is for the individuals in the organisation to be aware, to feel the value and the benefits of being engaged with social media. We would like an aim to be that we increase the visibility of services or offer. In other words, reduce the number of people who say, oh, I didn't know that service existed. I didn't know that you were here. One way that we could measure that is by basically asking people when they get referred into a service, ask them, how did they come to be referred? There was a recognition that actually asking people, how did you hear about the service or the organisation, is one of the most effective ways of measuring that. There are some ways of linking the offline world with the online world by getting people to interact with something that then creates a bit of a digital signature online. Things like using QR codes or Facebook's version of a QR code, using gamification. So in other words, the pizza chain down there uses gamification because the offer is you might win something by interacting with their online tool. The pizza chain gets to know that you're online and you might win something. Another aim is for social media to become an effective tool for internal communications. So there's a recognition that there's a need to link up networks across different sites potentially. So there are some organisations that are here that recognise that they are expanding and they need some way of people in different localities feeling connected. One way that you can get people, one way that you can be aware of who's in your network is to use things like polls and quizzes to do a kind of an employee engagement survey. In other words, you want to know how many of your people in your network are actually doing something with the network. So you might do polls or quizzes, but a recognition that you don't have to do that like every week. You could just do it like a couple of times a year to take, a bit like taking the temperature of your organisation. Figure out if what you're planning on doing is actually working. You can measure the numbers of people engaging with your social media and potentially find some way of measuring. Someone came up with the suggestion of measuring degrees of separation. This is a bit like that idea of how many handshakes are you away from the President of the United States. I've got on here handshakes from Jeremy Hunt. So it's an idea for you. Look, one of the last couple of aims is to recognise the things that we do well, or recognise the things that other people are doing well. Spreading the good practice. So one solution to that is to run competitions or awards where you get members of your community to flag up, nominate good examples. We also think one aim should be to have a good representation of different sorts of roles within the network, so you avoid the network being over-dominated by one particular sector. Like, say, you don't want an organisation that's just purely nurses. You want some nurses, receptionists, GPs, patients, social workers, physios, pharmacists. You want the broader the makeup of roles, the better. And we're suggesting one way you could do that is you could have some sort of checklist to make sure that you had each role represented, and you could maybe even nominate some champions, a bit like the idea of having a patient lead, a patient participation lead. A suggestion for a way of achieving this is to actually set yourself a smart target. So you say, we will get another 10 people joining our tribe by a particular time. Last point, one aim was to recognise that different people have different needs when it comes to learning about something. There's the concept of print 10, tell 10, teach 10. My understood now, this is the bit where I'm kind of trying to regurgitate something I've only just heard of. I think the general gist is some people will catch onto it very quickly, and all you've got to do is supply them with the information. There's some people will take on board that different way of doing things if someone just explains it to them, and then there's a third group where they need some sort of more intensive sort of teaching or instruction, hand-holding, if you like, to be guided through it. So recognising that different people in the organisation have different learning needs. Thank you.
So our question was, what can we do after today to get a social media health community started? And in our first 3 months, what would be the quick wins? So we looked at it in 2 different ways on different groups. Some said the we was from today, and some took it on their own organisations. The feeling was just do it. Ensure that you've got social media set up. Don't think about it. Stop, messing around with it. Just go and do it. People said that to consider which ones you use, whether it's Instagram, Twitter, Facebook, maybe you need to look at your target audience. They felt that Instagram, Snapchat were maybe for the younger people. A lot of older people use Facebook, and Twitter covers a wide range. So you may need 1 or 2 of them, or all of them. And removing barriers, so time, diarising a few minutes every other day, just to update it, because we all lead busy lives. Sometimes you can forget, but putting a reminder in your phone or your diary, just to remind you to do something. And someone said to look up setting a Facebook account. A lot of organisations don't have Facebook because it was considered at one time to be less professional maybe than Twitter. But now it depends on how you use it and how you set your settings. And I think it's a bit more acceptable, and firewalls are being removed probably as we speak. Someone suggested using social signing to manage. I'm not familiar with that, but apparently it's a paid application you can use to manage more than one account in one go. And the alternative with that is something like we do at the Innovation Agency, where everyone has their own account, but we can share things with our main innovation account. So we have a work account, and some of us have private accounts as well, and they're totally separate. But you can upload things to the main innovation account, or Kath will retweet things that are interesting. So rather than one person doing everything, lots of people are feeding into that, so it needn't be a big onerous task. And people said to join in with existing chats and tweets. Have a look on there, see what's being tweeted about, look at the hashtags and join in the conversations. It's a great way of joining in, they said. So the quick wins, people said, LinkedIn is a quick win. If you join it, lots of people seem to ask for professional relationships on there quite quickly, and encouraging others to share things. Individually, people said that they were going to contact the PPGs, the parent participation groups, and perhaps put posters up in surgeries and councils. They said lots of people are waiting in waiting rooms, so while they're sitting waiting, I know I've read posters about 600 times in my GPs. You could actually be tweeting something about your GP from a hashtag that you found on the wall. Selfie introductions. Some people said people like the personal approach. Put a selfie on with a bit about you and your role that people can see. They may have heard you on the phone, but they may not see what you look like, and people do like the personal touch. And use your account to see what people want. So ask the question, I've got a new Twitter account, what do you want to talk about? And then you're doing exactly what they're asking for. And one group had an individual idea of setting up a closed group for carers within their organisation to help solve some of the problems they've got with isolation. And they said they will monitor that and pick up problems very quickly, so that rather if someone doesn't pick up the phone, they can actually identify a problem and contact them and say, are you okay? So there's lots of things out there. So the bottom line is just do it.
So, and finally, this question was, what can we do in our own organisations to encourage colleagues to use social media? So I think quite a few of these points have actually already been covered, so I shall whiz through. So, first of all, training and education. So could the use of social media be included in inductions? And possibly in PDRs, and also opportunities for it to be recognised as continuous professional development. And the training and education should use positive models and examples of best practice. Introduce guidance of what you can do, not policy. Perhaps nominate social media champions, and those people should be from across the organisation. So, for example, GPs, patients, team leaders, porters. Perhaps introduce lunchtime surgeries on social media. Go back to basics as part of the training. So, don't assume that people all know what a hashtag and a handle is, and perhaps have some myth busting as part of that, going back to basics about how much time that using social media will take you, because I think some people have got this idea that it's really time consuming and it's going to take over your life. So you need to burst that myth. Perhaps use a coaching approach and a reassurance. Embed in all communications so that social media is part of everyday communications. Get management buy-in. So do some myth busting with your management about how social media can be used in a positive way. What are the benefits? So that in actual fact, staff can have are allowed access to social media platforms, which is quite an issue. Get customers, patients to support the use of social media. Perhaps use incentives to get people to join and engage. So those incentives might be competitions, giveaways, selfie challenges. Did we already mention that? We mentioned something, selfie introductions, wasn't it? And then also measure the impact and demonstrate that impact. Other things, an example of something already being used is Twitter badges, and these are physical badges that people are given as rewards of an example of best practice. Perhaps use email to more widely share the how-to. I think the example was given that actually everybody has an email account, whether they use them or not, and it's actually quite easy to open an email, and perhaps that's what's needed to more widely share the how do I set myself up. Perhaps use a Twitter wall on screens that are usually used in surgeries, for example. So the digital signage, use those to sort of share Twitter feeds of various kinds. I think I've already mentioned the coaching model. So some people may be truly terrified of social media, and perhaps by talking it through about what is it that they're afraid of, and helping them identify and overcome the barriers might be really useful. Perhaps use an example set by at NHS and get a different staff member or a team to look after the account for a period of time, whether that's a day or a week or whatever. And the idea that perhaps different teams can be encouraged to set up Twitter accounts might be a good one because it was considered safer and perhaps sharing the fun. There was a mention about CCGs, how a Twitter account can actually break down the barriers for organisations such as CCGs in the general public. So if you get different people using the accounts, perhaps it would make it easier for organisations like CCGs to communicate who they are and what they do, because not everybody knows. So I think I've reached the end of my tether. And finally, yes, actually for a lot of people to recognise the benefits of professional networking. Thank you very much.
All our facilitators. Okay. Thank you to all our facilitators. That was quite an intense end to a long day, but I think it was very worthwhile because we wanted to end up with something. We didn't want to just come and have talks and discussions and then go away and nothing changed. We want something to change. Even little things can be a reason for having an event like this. So thank you all so much for all your attention and all your contributions. Special thank you to all our speakers and our facilitators, to Kath, who's been supporting me hugely, as has Debbie, to John for the fantastic videos we're going to be watching later and sharing, and Jamie here from Savills has been very quietly making sure everything works very smoothly, and to all of you for coming, some of you quite a long distance, and for all your time. Hope you think it's worthwhile. We'll be sharing everything afterwards, so we'll be in email contact and on social media. Thank you very much.